Colette Mushimiyimana. I'm a mother of 3, 1 girl and 2 boys. I'm married. I have a master's degree in public health. I'm program coordinator of Kuzamura Ubuzima, or Growing Health in English, and I'm also the founder of the organization.
My name is Vanessa. I'm a single mother of 1 handsome boy, and I'm the assistant coordinator in Kuzamura Ubuzima, and I have a bachelor's degree in public health.
My name is Helath, and I'm working in KU as an agriculture and wellness trainer. I started volunteering since 2016, and I was studying in the university in biology, especially the zoology and conservation.
My name is Emmanuel. I am 40 years old. I am single. I am based here in Rwanda, and I work with KU. KU is the organization called Kuzamura Ubuzima on growing health. It works within the hospitals, especially 2 hospitals, University Teaching Hospital of Butare and Kabutare District Hospital. So it feeds patients who are not able to afford food because of different reasons. Maybe they come from far places or just they are poor. So that's the main activity of that organization. Even if it has now expanded its activities by including another program called Community Outreach Program, because they want to find those people also in the community and they make the changes, because those problems maybe they are facing in a hospital is not the root cause. The root cause is back home. So that's why you find them there.
Well, KU was founded exactly the 1st of May of 2015, and the reason was because in all the hospitals in Rwanda, patients are being taken care by their own families. And Rwanda being a poor country, some families come to the hospital very poor, and when the duration of the hospitalization becomes longer, they even become more poor. So with the findings of 2 American nurses that came sent by Human Resource for Health from America, they found out that babies in neonatology were dying very massively. Children in the pediatric wards were not healing, or they were lingering in the hospital. The duration of the hospitalization was very long, and they were wondering why. So one of them was my friend, and she came to me and she shared, because she didn't realize, she thought that patients have been eating, they have been fed by the hospital. Then I told her that it is not the case, because the patients are to be taken care by their own families. And if the families are poor, patients go hungry. So babies were dying simply not because they were not taken good care of, but simply because their mothers had no breast milk. The mothers of premature babies had no breast milk because they didn't have anything to eat. Children in the pediatric ward did not have enough food. They were only consuming medicine. That's why they could not cope with the illness. There was an organization from medical students who were doing the internship in the same hospital. They had feeding program in the surgery ward. They came up with fundraising, and they were only giving the money, and the patients' families could go pick the food in the canteen. But we realized that the food was not healthy. So I personally, in collaboration with the caregivers, we were going to the kitchen to cook. I would go to shop, I bring the food to the kitchen, together with the mothers of the children or their caregivers. We would cook the nutritive food and we would feed the patients. We started with 30 in numbers. That were some mothers from neonatology and children in pediatric wards.
The field started in 2015, a few months after the starting of the Kuzamura Ubuzima project. And it started in order to help the project feeding more, and especially the more organic food to the vulnerable patients, those who can't afford food, who came from far. We provide healthy and balanced breakfast and lunch every day to patients of different age with different diseases. Food has to provide all the essential nutrients in those 2 meals, as well as it has to be organic and digestible. Additional to the food for the patients, we provide teaching lessons for the caregivers. The lessons are all about hygiene, sanitation, family planning, and how to fight against malnutrition. Therefore, the participants get taught how to prepare meals in a short time, which simultaneously include all the essential nutrients. Additionally, breastfeeding mothers, especially mothers with premature babies, are being taught how to breastfeed. Families are also taught about contraception methods and how to use them to secure the future of the newborns and to avoid big family sizes, which is one of the biggest problems causing malnutrition. What I'm thankful for is that at the end they were all convinced that if this method can't work for me, maybe another one can work. And I also convinced them that before they take any kind of method, they have to talk to doctors.
Program we have in Kuzamura Ubuzima, we are just refined those people. Like the people we feed in a hospital, they come from families. And those families, they live back home in the villages, where we call it the community. So we go back to the community and we try to bring the education, which also we provide in a hospital, but we take it back to community because we want just like to influence a lot of people and also to make sure we are cutting the root cause, which causes the people to suffer when they are in hospital, especially for not getting food.
There are different projects depending on the targeted population which get implemented in the community. One of the projects is called the Perma Garden Project, and it teaches people how to create garden beds at the small and used space next to their house and plant in a sustainable organic way. Due to the technique of perma garden, water can be stored in the beds, which then can provide the growth to the vegetables all year long, and it does help in the fight against malnutrition and the poverty. There are different steps we go through to create these beds. One step is just to choose the location where the garden or just the beds are going to be placed. First is just to look where there is unused space. Second is to see if just the water from the roof can get there so that we can harvest the rainwater to get to the beds, especially through the pathways. A second step, we dig the hole of 60 to 100 centimeter. The depth is essential for water storage and for roots to grow deeply. The hole is filled with mixture of brown materials and also the manure then we mixed up with cow dung and the waste from kitchen, because they do have minerals that needed by plant, but as well they do play a great role in storing water under the ground, providing nutrients for the roots that helps the plant to grow. Everything we do use in those gardens are resources locally. They are available there. They are not purchased, maybe except from the seeds we plant in the gardens, but the rest of the thing are free, can be sourced there and found there in the press locally. The Perma Garden project has a big influence in the mindset as well as the food security of the people living in the village also improve. Vegetables can be harvested along the year, feeding the whole family, but also people can start implementing and collecting more beds because they are seeing the good result from the initial beds created. Due to the availability of vegetables, money used to buy those vegetables can be saved or just spent on the other essential things for families. Excess vegetables also can be sold on the market. Depending on the package of the project can last 1 year, which is good because it helps to do a lot of follow-up to track the impact the project is bringing to the community, and even reminding them to something maybe they might have forgot about maintaining the garden. Crops during that project and fruits that are planted in those garden. For the initial stage, we provide the fruits and the crops during that time.
The way of managing stress, there are different tools that can be used. So in KU we use yoga because it is more natural. You can have access to it every day if you know how to do it. You can be trained to do that and do it the entire life without needing any support from other persons.
For me, yoga is a mindfulness practice which focuses on breathing, physical exercises, including stretching and balance, and then also meditation. And they all combines to help for bringing back the harmony and the peace and the energy to this. Yeah.
Rwanda still has a big number of people who do farming. So yoga really gives the good stretch for the people who do substance farming because otherwise they are like digging. So they put much strains here on the upper back and shoulders, and even also on lower back. They spend many hours digging. So that's why for the people in the community it's very important. It is a way just of preventing stress. So that's for the people in the community. But why in the hospital, where we are working, especially in university teaching hospital, we don't have enough beds for patients and caregivers. And if I would say caregivers is someone who comes from your family. You don't have professional caregivers. It is someone who comes from your family to look after you. So in our observation, we were finding many people who were not sleeping in hospital, especially those who are doing caregiving services to their family members. I am maybe a caretaker and or just a caregiver, and I am not sleeping, so I'm not well. But I'm there to encourage my patients and to rise up the mood that my person will get well soon. But at that time, I don't have courage because also me, I don't feel well. So yoga sessions are there to motivate our caregivers, to give them hope, but also to help them relax because they are not given where to sleep during the night. And breathing exercises are really a good exercise you can do to relax.
It was something needed for them because when we do that, they release their mind. It brings the calmness to their mind and the relaxation to their physical muscles and joints.
And they go back with a lot of hope. And also they go back to their patients with a lot of motivation. They encourage their patients that will be okay.
Wow, the success is so impressive because, as I told you, I started from the very scratch with the beginning of the organization. We started by feeding 30 patients. Then soon after 6 months, after joining the efforts with the German medical students, we started feeding 60, then 90. Then today we are feeding feeding 125, but sometimes even during this time of the pandemic, they were even more because we were obliged to include the coronavirus patients that could not afford food. So sometimes we could even feed 150 a day. Because of that, our meal used to be composed of, it is still nutritive, but on our meal we used to give avocado and egg. But from the beginning of the pandemic, we stopped the egg and avocado. That is already reduced to the quality of the food that we feed. But the success story is amazing because soon after the beginning of the organization, like in 2 weeks, we could already see the progress. The breastfeeding mothers were having milk. Just in 2 weeks, they were able to have porridge in the morning, good and nutritive lunch, so they could produce enough breast milk and babies were no more dying of hunger. That was impressive. Children, the hospitalization stay of the children were being reduced. Patients in the surgery, they are also prone to spend long time of hospitalization. They are also no longer delaying to cope with their illness. And then other success story is the farm. We have come from farming 3 square meters to 4 hectares now. We now farm all kinds of crops. We now have vegetables throughout the year that can feed that big number of patients, but we also cultivate beans, maize, soya bean, cassava, sweet potatoes, Irish potatoes. We have bananas that we can sometimes give to our patients, some fruits. So yeah, the growth has been immense, although we want to make it more wider.
Our vision is huge, even if we are still small, but our vision is so huge because we want to feed all the patients in the 2 hospitals where we work, and we also have to have more. We want to have more impact on the community, in the community where we can reach more people, so that through our education and through all the package that we give them, from there it will be a way of reducing all kind of diseases related to nutrition. And if as someone who works very often in the hospital, and I meet so many nurses and doctors, their claims is that most of the people in Rwanda, they have diseases related to nutrition and poor hygiene. And when we teach people in the community, we also make sure that we include that part.
Well, the mission of KU was to promote health. It was simply to promote healthy nutrition to the hospitalized patients. And the goal is to even prevent. In public health, we believe that prevention is better than cure. So our goal is to prevent people from being malnourished even before they get sick. But then our goal is to also extend the activities of KU in another hospitals in Rwanda, because the situation and the problems patients face in the hospitals in all of Rwanda is the same. Poor patients go hungry. And as you have seen, although Rwanda is trying and the malnutrition is decreasing, but still, even though it is decreasing, but 38% of stunting is not that few numbers. So, but if KU is grown, like throughout the country, our services are offered, even the number of the stunting in the country would be even more reduced. Because as Vanessa said, we are not only offering the food, we don't only have feeding program, but we also have teaching sessions where we teach, as she said, hygiene and sanitation, family planning, which is the biggest problem. As we know, malnutrition is Most of the factors causing malnutrition is big family size. So if KU is spread like throughout the country, all those problems will be reduced, and of course the country will develop more, having healthy people.
From the bottom of my heart, and on behalf of Kuzamura Ubuzima, all the members, all the beneficiaries, I would sincerely thank the founders of Growing Health Germany, who are Saskia, Verena, Konstantin, and Julia. And part of Growing Health USA, Lady, Emily, and Craig, and all the members in US who have been working hard to help us to be where we are today. And I can't forget the regular donors who has been helping us. Without their help, we will not be here today. We will not keep working and do what we do today. And we also have to mention those special donors who has been with us the whole time since 2015 till now. Those are Dr. Queen Karen and Aide Ismaili and Hossein Ismaili and Daniela Weng. The last one, but not the least, who has really played a huge part in the community outreach program, is Maria Russo. From the bottom of my heart, I thank you so much for what you do for us, for the project, for the community outreach, and for everything. Thank you very much.
Breathe, twinjiza umwuka, inhale. Ah!